Chapter 11, Lecture 3, Adverse Selection and Moral Hazards. In the previous lecture, you learned about the market structure, and then you learned about the conduct. In this lecture, you will learn about the performance, specifically about the allocation efficiency and equity of the private health insurance industries. Let's start with the moral hazards, which basically with any health insurance is a situation in which individuals, once they are covered by health insurance, then they change their behavior because they are no longer financially responsible for the full cost of their actions. So this actually creates the moral hazards. So that could be even before the health before when consumers have less incentive to avoid risky behaviors. Suppose that I'm planning to go to the mountain climbing. The first thing I do, I go and check my health insurance, and maybe actually I double increase the benefit in my health insurance. So this is actually because I'm planning to have a risky behaviors. And then not that mountain climbing is the bad thing, but basically the people, they plan around that health insurance when they wanted to utilize more healthcare. So the ex-post moral hazard means that now I did go to the mountain and I actually fell, and I have some basically problem with back and leg and everything. So in that case, so I go to different doctors and physical therapists. I already actually packed up my benefit, and I don't look around, shop around for the better price, better actually providers that it's more cost effective. So because I don't pay the full price, and even if the provider actually offer me a technology, say that enhanced technology, health technology, I accept that because I don't pay the full cost. Last summer I broke my wrist, and I had to go to the emergency department. They gave me the wrist gloves, and then I would go to my doctor, and she gave me another wrist gloves because she said that that's not a good one. And again, I went to the physical therapist, and she actually advised me another wrist gloves for my wrist, and I bought all three of them. I had three of them, so I didn't know which one I have to use really. So because I didn't pay anything, I believe I paid the copay probably $20. So the insurance lowers the consumer's incentive to monitor the behavior of the healthcare providers, and then the insurance lowers the consumer's incentive to shop around and find the lowest price for medical services. So what the insurance do for preventing the people to actually avoid these moral hazards, they're increasing the premium. So the average premium payment in the real term increased over the past few decades, so to basically cover their costs. So don't worry about the health insurance companies. They make their profit more than physicians and even hospitals and anybody else. So now, if we wanted to understand the health insurance, basically economics or performance, basically here, that's the subject. There are three key parameters we have to pay attention. We have to understand the ratings of premium, adverse selection, and risk selection. So the rating of premiums, there are two categories, community and experience ratings. Let's start with the community ratings. When premium is determined by community rating, The expected medical benefits is based on the risk characteristics of the entire member population in the group, not basically based on the health history or risk status of a particular person. So this may differ. The rating of premium, of course, is different based on the geographical location and type of the contract, whether it is individual or family contract, and based on the benefit design, which basically based on the level of payment, co-insurance, deductible, and benefit cover. It's very similar to the car and house insurance. When you want a higher benefit, you pack up, get the maximum benefit. So definitely, if you have a you know about your health that you need more, you're going to have the maximum benefit here. And so that's the community rating, basically, is based on these characteristics, right? There are three main characteristics, not the individual characteristics. The experience rating is looking at the different risk categories. First of all, is looking at the age, gender, occupation, and prior illnesses. For example, the older people, they have to pay more than younger people. Women, they have to pay more than men. And type of the occupation is very important. If you're a firefighter, definitely you have to pay more than, for example, teachers. And prior illnesses are very important. If you're a cancer survivor, you have to pay more than those that didn't have any problem previously. So still the premiums, besides that three factors we mentioned, geographical location, type of contract, and benefit design, there are two other factors are actually added to the list. Relation between risk categories. Of course, all these factors are risk categories, and also expected healthcare costs. So what does it mean? It means that the health insurance experts, they calculate, they estimate if the person had a cancer or cardiovascular disease, they can actually estimate and calculate the expected healthcare costs in the future. Let's move to the adverse selection. So the second actually. So the adverse selection occurs when there is an asymmetry of information in the market between two sides of the contract, between insurers and between the subscribers. So here, if the person, the high-risk consumers, for example, has multiple diseases or is elderly people, of course, elderly people, we're talking about younger than 65, otherwise over 65 are covered by the Medicare. So in this case, those people with the high-risk consumers, they know more. They may know more about their health status, and those with poor health, with high utilization of the healthcare, so they may actually pay the low premium and utilize more. So what happened? This basically increased the cost over the time, the cost of the for the insurance, and here the insurer is forced to raise the premium for everybody, right? Alternatively, they can actually create another plan for the low risk individuals, and then if there is no way to basically find out about the background of the individuals, so the high risk person may actually buy the low risk individuals, pay the lower premium, but still use the more insurance. So in that case, the high-risk individuals are attempting to take advantage of this asymmetry information. So this is called basically adverse selection, and basically it's because of the asymmetry of information that between the insurers and between the uh, insurers and subscribers. So this basically constant changing of these health insurance plans by subscribers and um, create this instability in the market for health insurance and create basically high adjustment costs and on the society and creates inefficiency in our society. Um, and remember that adverse selection is because of the asymmetry of information and for when those individuals they know better about their health than others, so they can actually take advantage. And if say that before the Affordable Care Act, when we have the option of buying health insurance or not, um, so who you are expecting to buy health insurance, definitely those with the high risk in consumers that they know more about their background. So that's basically adverse selection. And the health insurance company, they know that who comes first to buy the health insurance if they have the option. If the people have the option, the more sicker, basically the sicker people, high risk people, they go first, and low risk people, if they have the option, they don't actually buy. So let's see. There are two types of rating premiums, and advocates of the experience ratings. They argue that the price is closer to the expected medical benefit and can reduce the practice of adverse selection. And insurers can prevent adverse selection by limiting the people's ability to change the plans and prior screening and experience rating. So basically, they wanted to assign the premium based on the people's characteristics and risk factors, right? And so they say that the community rating of premiums can lead to cross-subsidizing, cross-subsidizing of insurance costs and create inefficiencies, basically. So basically, it means that this low-risk people are paying for the high-risk people. So graphically, we can show this cross-subsidization, community rate of premiums and cross-subsidization. We have the usual graph of the premium or price in the vertical axis, and we have the number of the health insurance coverage in the horizontal axis. Suppose that the employer offer Q0 amount of coverage at a premium of 2,000 to all of the employees. Now, we have two types of employees, the low-risk employees and high-risk employees, as reflected by this graph. It shows that this there is a cross-subsidization of high-risk employees here. So what does it mean? That if the low-risk employees have the option of exiting this or having the choice of not to buy the insurance from their employers, so they opt out of the plan, and in that case, if the low risk opt out of the plan, the premium should be raised to $3,000. So this is very good graph for showing the cross subsidization. So as you can see that the graph is very good graph for showing how low risk employees cross subsidizing the high risk employees. Now, advocates of the community rating argue that the experience rating is inequitable and inefficient. Some people are charged a higher price for health insurance simply because of their poor health status, right? Or because of their gender. So that's not fair, right? So Let's talk about the risk selection, the third terminology here. The risk selection is if the insurers are unable to identify the health risk of individuals in the market. So basically, there is a asymmetry of information, right? So in that case, may structure their health insurance coverage so high-risk individuals reveal themselves. How they may actually if insurers can predict the unprofitable individuals, so their marketing strategy may actually be focused away from the high risk and even toward the low risk individuals. So that's actually, yes, that's very unfair, but that if you give the option to the health insurance industry, they definitely follow this to maximize their risk selection, to maximize their profit, right? So that's actually what the affordable care is all about, to not to have any option to reject any patient because of their prior actually existed illnesses or other risk factors. Now, the cherry picking behavior is that the community rating often creates cherry picking behavior. So that's again critics for the community rating. So cherry picking results when insurance companies craft marketing plans that attract healthier and avoid unhealthy consumers. So in that case, those individuals in the poorer health may find it difficult to acquire health insurance, and this happened especially before the Affordable Care Act. The insurance companies only wanted to have the customers, low-risk customers, that basically to maximize their profit. So individuals with a large group coverage are but in the large group coverage, this is not a problem, cherry picking actually behavior, because in the large group coverage, they're less likely to basically to fall a victim of the cherry picking, because basically it averaged out the low and high risk members. And then research indicates that cherry picking is not widespread as many suggested in the United States. Of course, it was becoming a problem before the Affordable Care Act. Now, advocates of the experience rating argue that this is more efficient and equitable because of individual premiums. More basically, it's very related closely to their medical conditions. So this is actually improving the efficiency, because of the high-risk individuals have a greater incentive to follow the healthier lifestyle. So they basically try to say that the unhealthy lifestyle, the unhealthy people is their fault. They don't follow the healthy lifestyle, and equity improves because individuals who follow less healthy lifestyle are forced to pay higher premiums, and the level of the cross-subsidization across the subscribers is kept to the minimum. Then advocate of the community rating argue that this is more efficient and equitable because of then this the advocate of community rating, they're actually talking about a high-risk individual like the elderly. So they, again, we are talking about the elderly of younger than 65 in the on the borderline, by the new health plan for by the Republican, the population in the age range of basically borderline 64 years old, they had to pay a highest rate. So because they were not eligible for the Medicare, and they were very actually in the borderline. So the high-risk individual like elderly are given a greater opportunity to buy affordable health insurance because premium reflects the health status of the entire population, not the individual. So the community rating may be more efficient because insurers do not incur the underwriting cost. We talk about the underwriting cost, which basically associated with the experience rating. Now, so the guarantee the guaranteed renewability in the individual health insurance market is the contractual feature in an insurance policy. So that requires that the insurers to sell another policy on an anniversary date of the current period and charge a premium for that policy that is not affected by any individual loss experience or change in the insured person's circumstance during the current period. For example, if the patient had a basically illnesses, then that basically happened after, so they don't have to change the premium. The performance of the private health insurance industry, based on the evidence shows that it's based on the measures and issues relating to the price and quantity of the health insurance and profitability of the health insurers. So these are the factors that determine the performance of the private health insurance, price and quantity of health insurance, and profitability of the health insurance. And what are the profitability of health insurance depends on the price of the profit cycle or underwriting of the health insurance is actually again another important subject. The private health insurers experience the 3 consecutive years of profits and followed by 3 consecutive years of losses. Now, this holds for both commercial for-profit and not-for-profit plans. So what are the reason? The causes for these cycles are supply and demand forces. For example, they have minimal barriers. So what happened, minimal barriers means that it's very easy to enter when there is a profit in the market. So for the competitors, they come to the market, enter to the market, and then so what happened? They gain and increase the number of the suppliers in the market, and that end up to decreasing the profit and then exit the market. So that supply and demand forces is basically shifting very fast because of the minimal barriers in the market. And then also industry pricing action, basically industry, they may actually act as a tacitly collude, or COMWEB model means that they actually decrease their prices to make the other smaller firms to exit out of the basically market because of they can't actually supply in the low price. External factors are general economic condition because of the recession. People, they don't have money to actually buy health insurance and so on.